Hi everyone, my name is Joy. I am a dental assistant slash orthodontic assistant, and as you guys can see by the title, we're going to be talking about my MSE and LFE experience. I originally did a video on TikTok and it got quite a lot of views, and a lot of people had some questions, so I am doing a YouTube video. I'm going to give you guys background information about me and then give you as much information as possible about MSE, LFE, and my overall experience. I have some notes written down just so that I didn't forget anything, and then I'm also going to be looking on TikTok just to go back and reference some questions that people have had. People have DM'd me on Instagram and commented on TikTok. I haven't done an update on TikTok about my experience. I've done maybe one, but I did get a few requests to do just a YouTube video. I did actually look up on YouTube to see if anybody had documented their experience or documented anything, and there's not any videos out there, so here's my video. You are getting this perspective as somebody that is an orthodontic slash dental assistant with 3 years of experience, as well as somebody who is a patient. So, background, again, my name is Joy. I'm 25 years old. I have 3 years of dental experience, 1 year in general slash surgery, and 2 years in orthodontic. I did have braces as a child. I had the phase 1 between 3rd and 5th grade, and then I got the braces removed, and then I had braces again in the 2nd phase from 7th to 9th grade. The reason for me getting braces as a child was because I had impacted teeth, which means that there pretty much wasn't enough space for my adult teeth to come in, so that's generally why a lot of kids get braces, besides like the angulation of them coming in at different angles. I had impacted teeth. I also had my wisdom teeth removed when I was 14, so about 9th grade. I worked at a orthodontic office slash pediatric office the doctor specialized in airway and breathing. If you guys are also looking at me while I'm talking, I do still have my LFE in, and the reasoning for that is because I moved out of state. I no longer work in my home state where I had the orthodontic treatment done at, and where I'm originally from. So the doctor that I work for, he specializes in airway and breathing. The office that he is at is in Fairfield, California. You can Google him. I will give this disclaimer, just a consultation. I do believe that he does Zoom consultations, but he would prefer to see patients in person. I'm also not telling you to go there just for this consultation either. This is just a disclaimer as somebody that worked for him, worked at his office. It is very difficult to be an out-of-state patient, or let alone an out-of-the-city patient. We did have a lot of patients that traveled from all various of areas to come see him. However, if you are solely looking for an MSE and LFE experience, I don't know that getting treatment from someone out of state is your best option. I would definitely say, just research a variety of options and see what is the best possible outcome for you. That's just my disclaimer. I'm trying to be as helpful and as informative as possible. Along with the disclaimer, all doctors have a large variety of training from different states, wherever they went to school at. Everybody's training is different. Every doctor does things differently. Every doctor has their own personal practices, beliefs, and opinions, as they are allowed to. I would say if you do get a consultation from any doctor, ask that whatever you guys discuss in a consultation is in written form, whether it's from the doctor that I previously worked for or a doctor in your state. Get a written form of what the treatment plan is for you. And with that being said, it is not beneficial to you to go and compare and contrast consultations from other doctors, because every doctor, like I said, has their own practices and beliefs and how they like to do treatment with their patients. So now that the disclaimers are out the way, again, another disclaimer, everything that I am stating in this video is my personal opinion, my personal belief, and my experience solely. Nobody has asked me to do this video besides other future patients that have reached out via TikTok or via Instagram. My previous doctor did not ask me to make this video. The doctor that I work for now did not ask me to make this video. I am not bashing any doctor in this video. I am not saying that one treatment is better than the other, because all patients are different. My experience is not going to be the same for you. Your experience is not going to be the same for me. I just have to put this out there so that nobody thinks that it's going to be peaches and cream and everything's going to work for me the way it's not going to work for you the way it did work for me, okay? So, got the disclaimers out the way. Prior to me working for this doctor, I had no knowledge about airway orthodontics. I had no knowledge about any future information that I'm about to tell you about my experience. I had no knowledge prior to me working for this doctor. So, I worked for Kevin Adair, who specializes in airway orthodontics. We did MSE, which is a maxillary skeletal expander, and LFE, which is a lower fixed expander. We also did expanders, crow's eyes for small children, and mostly small children and a few adults. We also did TPAs, orthotropics, and sagittals. We did braces and only had very few Invisalign cases. I had worked for the doctor, I would say 6 to 8 months before I started treatment. I found out about the treatment, about MSE and LFE, through the office that I was working at. Prior to working for him, I had no knowledge about anything airway related at all. So as an employee, I seen the results and the treatment that children were getting and the different, options for them in terms of consultation and then starting and then, final results. I was very intrigued. I am a very why type of person. I need to know why you're doing what you're doing and then what the end result is going to be. So in dentistry or in the ortho community, the saying is ortho by 8. So by 8 years old, your child should see an orthodontist, because that is that in between phase of their baby teeth falling out and their adult teeth coming in. That's generally around the good time where you want to see an orthodontist so that you can, expand your palate, get braces, Invisalign, whatever the case may be for you and your child or yourself. Now, the doctor that I worked for, he liked to get kids in at a really young age so that you could expand their palate while they're really young, while they're still adjusting, and just to kind of make things easier for them. And then generally along the road, they may or may not need braces down the road because of the treatment that we gave them. Now, getting into my personal experience, after having braces for the first time as a teenager or a child, I did not wear my retainer. I wore my lower one and then I actually threw it away at a restaurant. I had my upper and I would wear my upper every now and then, but I eventually just stopped wearing it overall because I knew that I wanted to undergo treatment with this doctor, with my boss. So going into treatment, I had a consultation. They do photos and x-rays. Within my consultation, I have a 32 intermolar width. It was very hard for me to fall asleep. It was hard for me to get up out of bed in the morning because I was like tired. I had bags under my eyes. I was restless / a wild sleeper. I didn't have any dreams and I did not remember them. I was a mouth breather and I tongue thrusted my lower teeth. So that was noted in my consultation, and then I do have some clicking on the right side. Besides that, I don't have any other, I guess, major issues, but those are major. So in a sense, there's a book called like a 6-foot tiger in a 6-inch cage, which references your tongue. Your tongue is, you know, muscle in a sense. So basically the way my doctor described it to me is that there's not enough space in my mouth for my tongue to sit. So when you go to sleep at night, your tongue should sit up at the roof of your mouth and not fall back. So generally, depending on the patient, oftentimes people's tongues fall back, and then that is what causes you to open your mouth and mouth breathe. There are also a variety of other reasons why you would open your mouth to mouth breathe, but in a sense your body is just trying to keep you alive if you're not getting oxygen through your nose. So my treatment options were MSE, LFE, and braces, and or Invisalign. And I also had to do it's not like speech, I don't remember the correct term, but it's similar to speech therapy. But it's not necessarily talking, it's more so of working the muscles in your jaw and just overall in your mouth. So I had started treatment. I'm just gonna pull up some photos. So I started treatment on June 22nd of 2020, that's when I got my lower fixed expander, my LFE. And with the lower expander, it's cemented to your molars. So your 6-year-old molars come in. Those are the first molars to come in, and wherever they are at is pretty much where they're going to be at your entire life, unless you get some sort of treatment to create any type of expansion. So for the lower fixed expander, you use a key to turn it once every 4 days. And then I got the MSE put in on June 29th. So it's only about a week apart. And I'll have photos inserted. So with the MSE, it's screwed into your upper palate. Your upper palate is contained of two separate bones in a sense, whereas your lower jaw is one bone. There are different doctors that do different things. However, my doctor, you know, we cemented it and then, you know, screwed it in. I was numb for this process. For the upper, I was not numb for the lower. So I do recommend that if you are getting the upper, make sure that you eat prior to getting it. Or if you're getting the lower as well, make sure you eat prior to getting it. I will say that the upper was more uncomfortable than the lower was. So for the MSE, the maxillary skeletal expander, it's screwed into your upper palate and you use a key to turn it. For the doctor I work for my boss and my treatment, and the treatment that we instructed others, you're gonna turn it 2 times a day for 5 days, and then one time, and then you send a photo or you come back in a week later and we take a look, see how everything's looking, and then 1 time a day up until you get the gap. So pretty much between your front two teeth, you're generally supposed to get a gap. For the younger patients, teenagers that received this treatment, got the gap within, I would say 10 to 14 days roughly. I would say no more than like 21 depending on the patient, but that's a reach. For me, I did get the expansion, but I did not get the gap. For the MSE and LFE treatment, for the MSE treatment, for anybody over the age of 25, there's a 50-50 chance that this will work. Because you are considered an adult and your bone is fully formed, this procedure has a 50-50 chance of, I guess, a success rate. So I did not get the gap, however, I did get the expansion. And then my expander was also turning or bending improperly, so I completely stopped turns. And then I'm gonna backtrack a little bit. What is airway orthodontics? It helps prevent deficient or excessive facial growth, disturb sleep, crooked or impacted teeth. If started early, restore airway, balance facial structure, jaw relationship, optimal proximal and occlusion contact. What qualifies someone for airway orthodontics? Now, we had, specifically the office that I worked at, had a questionnaire for consultations. Some things that I noted down were snoring, restless sleeper, mouth breathing, dark under eyes, bags, hard to fall asleep, hard to wake up, tongue thrusting, jaw clicking and popping. We had a lot of younger patients that, couldn't focus in school, were snoring, mouth breathing, hard to fall asleep, jaw clicking and popping, which is, you also may hear it as TMJ. Restless sleeper, dark under eyes or bags under their eyes. I am not a licensed dentist, so take this information as you will. This is information that I learned through working for the doctor. What does the MSE do? The MSE splits your upper palate into two, creating expansion. The bone regenerates, closing the sutures. So when you are turning the key for the maxillary skeletal expander, your teeth, in a sense, your palate, in a sense, will completely split, and then you would do braces to close everything all together, but you would still keep your expansion. And so the bone would pretty much close, and then you would keep the expander in for 3 to 6 months after your last turn, to ensure that the bone fully healed. For the lower expander, you are widening your jaw, so what you do on the top, you have to do on the bottom. You can't just only do one. Now granted, you may not have this exact treatment where you have to do both, but in a sense, you're still creating expansion. The lower jawbone is one singular bone, so you would not and cannot split this one bone. However, for the top you can. Treatment varies for each patient. So your experience may not be the same as my experience. What you need may not be the same as what I needed. So my results from having treatment, I went from a 32 to a 38 millimeter inner molar width. So my first 6-year-old molars that I talked about before went from a 32 to a 38. So I'm not snoring, I don't mouth breathe, I don't have bags under my eyes. It's easier for me to fall asleep. It's pretty easy for me to get up in the morning. I am not a wild sleeper anymore. I have vivid dreams, and I also remember my dreams. I seen and felt a difference within, I would say, about maybe three to 5 weeks roughly. When I first started the turns, I felt, we don't like to use the term pain in dentistry, so it's the MSE and LFE experience are uncomfortable, but it's not unbearable. I was not in huge pain, but it was uncomfortable. It was a lot of discomfort. It takes a lot of adjustment for your mouth or your tongue to get used to having something on your upper palate. My lower one, it wasn't so much. I kind of just, my lower one was easier for me to adjust to than the MSE. Food kind of gets stuck up there. It's uncomfortable. It's hard to swallow. I wasn't really a fan of it. And then there's like an indent or an imprint of the expander on your tongue. It does hurt sometimes when I wake up in the morning, because when you're in REM sleep, when you are in your relaxed state of sleep, your tongue, expands. So oftentimes it was really tight, like my tongue was kind of just uncomfortable to say the least. So I used to have pretty heavy, like puffy bags under my eyes. They're definitely not there as much as they used to be. So overall, I will say that I had a good experience. My options in terms of treatment were to either do a second MSE, or another form of expansion had I continued living in that state, or if I was able to make more frequent visits to go back home to California, because I no longer live in California. I sleep amazing. I probably haven't had the best sleep ever since I got treatment, because regardless of how many hours I slept, I was still tired or like exhausted, or just felt like I didn't get enough sleep. Yeah, I am very appreciative and grateful that I got treatment done. This was not an option as a child when I had my first go around of braces. So that is my experience with my MSE and LFE. Again, my name is Joy. I am a dental assistant / orthodontic assistant. If you have any questions, please comment them down below, or I don't know, find another way to reach out to me on another social platform if you want a faster response. But I definitely do my best to get back to people as quick as I can. I hope that this video was informative and helpful. Again, if you have any questions, comment down below, and I will do my best to get back to you. And I hope you found any of this information helpful for you and your experience.